Welcome, everyone. Today, I am going to be discussing common injuries that people come to yoga with looking for ease or just trying to heal their injuries. Hi, I'm Maureen Dinkins. I've been teaching yoga for over 20 years. I have studied the body, emotions, and spirituality and how they are all connected for 2 decades. So if you're ready to dive in and find out what are the most common injuries that people come to yoga with and how yoga can help heal those injuries, then stay right here for this amazing masterclass because I'm going to give it all to you. I'm going to give you all the information that you need to use yoga as a healing technique. So let's get started. So some of the most common injuries that you might see over the years that I have seen are things like shoulder pain, the rotator cuff. Rotator cuffs are very, very common, and you wouldn't think so, but we're not really sure why people get a torn rotator cuff. Of course, if you're a pitcher in Major League Baseball, you may get a torn rotator cuff from overusing it, but sometimes we get torn rotator cuffs and we don't know why. It could be from a car accident. It could be from carrying something heavy over and over and over again. Sometimes mothers will get a torn rotator cuff from carrying their children on the same hip over and over and over again. And over time, it just starts to tear little by little by little. And you can see right here in this picture that it is a ligament right here, the connective tissue of muscle to bone, okay? And this tear can be extremely painful. And when people get this tear, sometimes they don't even know it. They just think that they have some shoulder pain. But when they get this tear and they come to yoga doing lots of down dogs, doing lots of chaturangas, low push-ups, it tends to exacerbate the situation. So those poses are not recommended for people with shoulder injuries. But how do you know if you have a torn rotator cuff? Well, first of all, you have pain, especially when you move your arm, especially overhead, when you do moving your arm like this, right? You're going to feel it, and it's just going to go click, pop. And you may even have weakness. You can't lift heavy things with that arm. It's just either too painful or it's just the muscle memory is just not there. Also, you have limited range of motion. So we did talk about bringing your arm up overhead. That would be very difficult. So when we do a down dog and we're upside down with our arms up, this can be very challenging for people with rotator cuffs that are torn. So we don't want to put them in that type of position. Something gentler, but allowing them to still get full range of motion would be something like a child's pose where they're on their knees, sitting on their heels with their arms stretched out and their forehead on the mat. So it's a more passive type of pose. In addition, a crackling sensation. You might hear some snap, crackle, pops. You might hear some snap, crackle, pops happening when you move your arm. So that can be an indicator that you have a torn rotator cuff. And then also difficulty sleeping because the pain is so uncomfortable. You can't find a side that's going to make you feel comfortable. If you sleep on the side of the torn rotator cuff, it hurts. If you sleep on the other side, your shoulders pulling down and it's completely uncomfortable. So this is one of the most common injuries that we see students coming to yoga with. Now, another common injury is the knees, and there are lots of different types of knee injuries. Let's talk about a torn meniscus. The torn meniscus is probably one of the least difficult injuries to have because what happens is here, the tissues start to kind of tear away a little by little by little from the meniscus. And you can see this blue part is the meniscus. And when you get little tears here, it starts to pull away, almost like a piece of tape coming away from its roll. And there are really great surgeries out there right now where they can go in with a laser. You can stay awake while they do it, and they just numb the affected area. And they just take the laser, and then they kind of scrape away that flap that's sticking out. And then you have a smooth surface again, and it heals itself on its own without further tearing. Now, that would be something minor. Of course, it could be worse, and it could tear straight through, and some sort of more major surgery might be necessary. Well, how do you know if you have a torn meniscus? Well, here you go. You have pain, especially when twisting or rotating your knee. So any yoga poses where you're turning your knee out to the side could exacerbate the situation, and you don't want to do that. There are specific yoga poses that can make certain problems worse, like down dog with the rotator cuff, and maybe what we call Janu Sirsasana, or head to knee posture, in a seated version, could also exacerbate a torn meniscus. Maybe even a lotus posture or a half lotus posture. When it first tears, you may have some swelling. So that would be a good indicator that maybe it's time to take it easy. In addition, stiffness. After a few days, weeks, or months, you may have stiffness in the knee and you're not able to give it the full range of motion that it needs. And then it's locking or catching. The knee might lock or catch when you try to move it, meaning it gets stuck, or you feel a little bit clicking or some sort of movement, or maybe you even feel some kind of bone on bone situation, and that would not be good. And then also difficult in bearing weight, pain when trying to bear weight on the knee. So when you're walking, or maybe you're just leaning to that one leg, you may feel some more pain in the meniscus area, and you would want to get this checked out as soon as possible. Also, don't push it, take it easy, and take your time in the poses. Another injury that we see a lot, another knee injury, is a torn ACL, anterior cruciate ligament. So the ACL is a very common one, especially for athletes. And you can see right here between like the meniscus and the femur, right here. If this tears, that could be a big problem. And most often you will need to get surgery, although the body does have an amazing ability to heal on its own. So in the past, what they used to do is they used to cut off the tears right here and then reattach the ACL. And what that does is it prevents full range of motion of the knee bending. So I have older yoga students who had this surgery done in the 1980s and 70s and maybe even early 90s, where they just kind of like cut off the ripped edges of this torn ACL and then reattached it, making the ACL much shorter, and they're unable to bend their knee past 90 degrees. Conversely, my husband has 2 ACL replacements, where what they did was they replaced the ACL with a cadaver. Now, a cadaver like ligament from the ankle, which is a little bit longer, a little bit sturdier. Now, he still doesn't have full range of motion in his knee, but he can definitely bend his knee past 90 degrees. That's one way. Now, my niece also, who is a soccer star, she also had a torn ACL, but because she is younger, much younger, what they did was they took one of her hamstring muscles and made a buckle here with the hamstring, the smallest hamstring, the one that goes down the middle. You have 3 hamstring muscles, the outside one, the underneath one, and then the one on the inside. And they made a buckle, and she does have full range of motion, but now she's missing one of her hamstring muscles. So she was able to go back and play soccer again after that injury. So when you are younger, they're going to have a different method of healing this than they would if you are older, depending upon your activity level. How do you know if you have a torn ACL? Well, first you may get a loud pop. You might hear a popping sound at the time of injury. Oh, I can't even imagine what that must feel like. And then you would have severe pain when you try to stand or walk. Rapid swelling. Swelling usually occurs within the first few hours. Before my husband had his ACL surgery, he was always icing his knees because they would always get swollen, because he used to be a professional skateboarder, and that's how he injured his ACL. And he waited nearly 20 years before he actually had surgery. I don't recommend you waiting that long, but you know, he was just never ready to do it, and he didn't want to stop doing what he was doing. So then you might have instability. You have like this popping or cracking. Your knee might move out from side to side because the top of the knee is not stable, right? It's not being supported. So you might have this type of motion going on with the femur and the shin muscle. And then, of course, loss of range of motion, difficulty fully extending or bending the knee. And when you extend and bend the knee, you may even have some popping or cracking sounds. So those are telltale signs of a torn ACL. Now, what about the spine? Bulging, herniated discs is one of the most common things I hear from students that come to my yoga class. They're like, oh, I have a bulging disc, I have a herniated disc, and I thought yoga would heal it. Yoga can heal these only if you do it properly. So let's look at the herniated disc right here. You can see in red, this herniated disc is shooting backwards, okay? It's shooting towards the back of the body. So certain poses like forward folds are not going to be good for this type of herniation, because when you fold forward, it's just going to cause more pushing out or more herniation. Oftentimes, when you have a disc that's herniated like this, these two bones, these two like spinal bones, you're going to see more of something like this. It's like a V, where these two bones may come and touch, and you'll start to get some arthritis there, rubbing the two bones together. So what types of yoga poses would be good to do for a herniated disc? Definitely not forward folds, but back bends. Back bends would help to open up this area and help relieve some pain off of this area. Same thing with a bulging disc. A bulging disc is just a minor herniation. We have degenerative discs, where the fluid sacs between the vertebrae is starting to deteriorate. And then we also have thinning discs. The same thing is happening here. Too much pressure. If you're overweight, or if you do a lot of standing and you're overweight, you're putting a lot of pressure on your lower spine. And when you're doing that, you're causing more injury to your body. So the lighter you are, the less pressure you're going to be putting on your bones, and the less likely you're going to have these thinnings, herniated or bulging discs. Now, how do thinning or how do bulging and herniated discs happen? Oftentimes they happen like something like an ACL. It's like a one-time thing, whether it's a car accident or you're lifting something, or maybe you sit for long periods of time and the muscles around the spine are weak, and then you go to work out, and next thing you know, you're in pain. What are some of the common, feelings? How would you know if you have a herniated or bulging disc? First of all, pain with movement. Increased pain during specific movements and activities. Bending the back. You can also have herniated discs in the neck. And, you may feel some numbness in your shoulders, arms, and hands. Muscle spasms. Sudden involuntary muscle contractions in the affected area. So you've seen people, and maybe this has been you, where people have had pain in their spine and they just have to lay down, or they're on the ground and they can't get up. Their muscles are spasming. Why? Because it's an indicator that something is wrong. Remember, pain is not the problem. Pain is just the messenger to help you figure out what the problem is. Postural changes in posture to avoid pain, such as leaning forward, leaning to one side, or maybe you've even seen people kind of leaning back, right? So the herniated disc can go in all directions. It can go back, it can go forward, it could go right, and it can go left. If it's shooting out to the left, you want to do right side body stretches. If it's shooting out to the left, you don't want to do left side body stretches to push it out even more. We already talked about numbness in the hands and arms, but if you have a bulging disc or herniated disc in your lower back, you may have numbness in the legs, feet, and hips. You could even have sciatic pain. And if you've never suffered from sciatic pain, let me tell you, it is extremely painful. But the sciatic pain is not the problem. It's not the sciatica. The sciatica is a nerve. It's as big as a cable cord, probably about as thick as your pinky, and it goes from your lower back. It weaves underneath your glute muscles, and it goes all the way down the back of your leg. So when you have a herniated disc, and this isn't always the case, sometimes you have muscle spasms just because your body's going through changes, or you're working out a little bit harder, or you're doing something new, or you sit for long periods of time, your muscles start to spasm. And when your muscles start to spasm, because that sciatic nerve is woven in between the muscles, it's causing pain in the sciatic nerve. It's squeezing that sciatic nerve, so you can have pain. But if you have that sciatic pain, you see how long it lasts? see if you can do some yoga poses and ask your yoga teacher to help you. But if you really think that the sciatic is indicating a problem, go get an x-ray or an MRI right away. One of the first things you need to ask your doctor after having an MRI, which way is the disc bulging? Because it'll say it in the MRI report, but if you can't read that MRI report, then you don't know. Of all my 20 years of teaching yoga, I've asked every single one of my students who came to me with this problem. And they said, I have a herniated disc. I can't do blah, 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 blah. I can't do this pose. I can't do that pose, whatever. I shouldn't be doing. My doctor said I shouldn't be doing this. I said, well, which direction is your herniation? Once in all of 20 years, one time a student said, it's bulging to the left. Great, wonderful. Now I know exactly how to teach you. I know exactly what poses you should be working on and what poses you shouldn't be working on. So just by knowing which direction your herniation is can help heal or can help exacerbate the situation. It's very imperative to know this. All right. And then also weakness in the shoulders, arms, and hands if you have a bulging or herniated disc or even a thinning disc in your neck. Now remember, some of the smallest bones in your body are in your neck. But some of the most important information is the nerves that go up and down the spine, bringing information from the brain all the way into the body. Now, if you have a herniated bulging disc or starting to have arthritic bones in your neck, those information systems are going to be cut off or they're going to be dull. So it's very important to make sure that you're not putting too much pressure on your neck. You're not turning your head in the direction that's going to cause more pain. So bulging disc is probably one of the most common ones that I've heard, or herniated disc. Now, how can yoga heal these injuries, right? We always hear it, like maybe even your doctor says, hey, go to yoga, you'll heal these injuries, but then you go to yoga and maybe you feel worse, or maybe you don't feel better, or maybe you just don't know how the yoga is going to heal. Well, how can we use yoga to help heal our bodies? Well, first of all, most pain is related to some sort of emotional trauma. So healing injuries, pain, or disease takes time, patience, and a deep connection to our body. You're like, well, I was just skiing and I fell down and broke my ankle. That's just an exercise injury. You could have broken your wrist. You could have broken your back. You could have broken something else. So depending on where you have your injury, those are some of your weakest places in your body. Emotionally, maybe. Physically, maybe. So, it's important to know that the body has an amazing ability to heal. The body will heal if you know it, if you believe it, and if you connect to it. If surgery is part of your healing plan, then you need to take things slow. Take enough time to rest after surgery and be prepared to get comfortable with the unknown. All injuries will take about a year or more to fully heal, whether you need surgery or not. I had a torn hamstring, and it happened in yoga. Injuries happen. Don't quit something just because you get an injury. Tennis players don't quit tennis just because they get an injury. Basketball players don't quit basketball just because they have an injury. Why would you quit yoga just because you have an injury? It happens. Physically exerting yourself can be painful sometimes, and it shows us where our weaknesses are. But why does it take a whole year to heal? My doctor said it's only going to take 6 weeks. Maybe 6 weeks for the scars to heal, but not for your whole body to be fully healed from something that was minor. You are not separate from your body. Your body is one. So if one part of your body is injured and needs healing, your whole well-being is surrounding that injury to help heal it. So why does it take so long? 1 year is not a long time for our bodies to heal, change, and recover from the actions and beliefs we've had put upon it. Every time you justify your injury, you increase its power. Every time you make peace with your pains, they subside. So how many times have you said, oh, I can't do that. I have carpal tunnel syndrome. I can't do down dog. I have carpal tunnel syndrome. Oh, I can't do that because, this, and I can't do that because every time you argue for your limitations is another layer that you're putting on your injury. Yes, you may not be able to do that, but all you have to say is, I'm healing and I'm trying, because your body can hear you. Your body will be and do exactly how you say it will. So if you continually say, I can't do that because I have a torn hamstring, or I can't do that because of whatever reason, you are arguing for your limitations. And when you argue for your limitations, you will never grow and change. You will always stay the same. And you may even go backwards. So give yourself a whole year to heal, not just the body, but to allow your mind to accept the changes in your body, allow your emotions to sit with the body and deeply connect with your body, and allow it to take that time to heal. And so when you are going through your healing journey, that year of coming back from where you were, give it some time, because you're not going to be 100% for a whole year. And there's no need to push yourself too hard and injure yourself again just because somebody said you're going to be better in 6 weeks. So always see your pains as a lesson to improve your overall health. Why? Why? It's just an injury. I can heal it. No, it's not. It's a message. And that message is telling you that something bigger is at play, and you are disconnected from your body, and you need to take some time to connect with your body and heal, knowing that your pains are not holding you back. Pain is not the problem, but a messenger to help you become better in the long run. Once you decide on healing yourself, one can come back from almost any type of injury, illness, or pain. But there are 5 levels of illness. And once you pass level 3 and step into levels 4 and 5, drastic measures are inevitable. If you have a pain, a chronic pain, or maybe you have a torn meniscus or something like that, and you continue to ignore it, and you continue to live the same lifestyle that you were living when it happened, it's just going to get worse, and you're not going to be able to come back from it without some sort of drastic measure. And that may mean surgery. That may mean painkillers. That may mean a lot of, damage, extra unnecessary damage to your body in order to heal. And so we want to be connected to our bodies. And when we know something is not right with our bodies right away, we can start to take care of ourselves. When we are connected to our bodies, we can say, oh, something's wrong here. I need to rest, and I need to see what's going to happen. I need to eat healthy foods. I need to maybe go for a walk. I need to spend time in nature. I need to get off of my phone. I need to meditate. I need to care for myself. I need to get a massage. I need to see my acupuncturist. I need to see my chiropractor. Whenever we have pains, my husband and I, right? First thing we do is we go to our chiropractor, our acupuncture, or our holistic doctors. We start there because they will tell us whether it's something out of their scope and we need to find something deeper or more powerful, like Western medicine, or they'll tell us exactly what they understand to see in our bodies, and they'll give us the tools to heal ourselves. But if those are levels 1, 2, and 3, being able to heal yourself. Levels 4 and 5, you're going to need help, but you need to make those decisions for yourself. How bad is it? And you can only heal yourself. The doctor can do the surgery, but you have to do the healing. Nobody else is going to heal you, right? You have to heal yourself. You have it within yourself. You need to heal your own body. The surgery is the fix, but the rest of the job is yours. And that goes for disease and any type of illness. The doctors can give you the medicines, they can give you the treatments, but it is your decision to heal. You can't put all of your faith in the doctors to heal you. No, your job is to heal. Their job is to do the work to get you back into shape so that you can do the healing. So, as we go further, how to use yoga to connect more deeply with your body. How can you do that? First of all, you need to be patient. Don't say negative words about yourself, your body, your performance. Your body can hear and feel your thoughts and words. And every time we insult ourselves, it exacerbates our issues. Every time you say, I have a bum knee, yep, you have a bum knee, and it's going to stay a bum knee, and it's probably going to get worse for the rest of your life. Or, I have an old injury and it just never healed. Of course it never healed because you don't believe it will. And you never gave it the time and the space to do so. So be patient, right? We don't want to exacerbate the situation by speaking negatively about our bodies, because you are sacred. Our bodies are sacred. We only came into this world with one body, and we were all given a Ferrari, but a lot of people end up with a Dodge Neon by the time they're adults because they don't take care of it. Now, do what you can. Know that your body wants to move. And even though pain and injuries, even through pain and injuries, our bodies need movement to stay mobile for our entire lives. And you may say, well, I can't move my arm past here. Fine, move your arm to here. Move your arm to here every day. One of my yoga students in the middle of the advanced yoga teacher training had a torn rotator cuff, and she had to get surgery. And luckily for yoga, she was able to continue moving. And not only did she go to the physical therapist and do what the physical therapist told her, but she continued her exercises every day and noticed the sensations as she was going through the healing process, right? The doctor, the physical therapist gave her some movements to work on. So she had, she wasn't able to lift her arm very high. So they said, take one arm and use the left arm to help move the right arm. Your body needs to move. And every day, if you increase that motion by even a millimeter, say you can only bring your arm to here, then maybe the next day it's here and the next day it's here. Well, in 100 days, it's here. In 1 year, you're back to where you were. So take it slow, be patient, and do what you can. Know that your body wants to move even through pains and injuries. Your body needs movement to stay mobile for our entire lives. When people had a stroke, back in the olden days, like when I was young, like 80s and 90s, they would, when you have a stroke, one side of your body gets paralyzed. It's usually the right side of the body that becomes paralyzed. And they started, training people to use the left side of their body so they could do everything that they needed to do. Well, and then they realized by encouraging them to use the stronger side of their body, it made the more paralyzed side of their body weaker. So now they encourage them to start using the side of the body that is weaker because it will strengthen it. And over time, with physical therapy and practice and belief, they are able to get more mobility back in the right side than ever possible before. So don't not move your body just because you have pains and injuries. Go to your edge and do not pass that edge. And every day, let that edge be a millimeter more than it was the day before. And third, treat yourself well. Like I said, don't talk negatively to yourself. Every time we take in negativity, unhealthy foods and drinks, or when we expose ourselves to painful experiences that don't support our well-being, we take a step backwards. So every time you watch something negative on TV or you're on the internet, or even like true crime dramas and, Law and Order and those murder shows, all of those things, that's negative. It's dark. And every time you watch that, you're just bringing it into your body and you're filling your body with more darkness. But if you watch funny things and happy things and uplifting things, those things heal you faster. It uplifts you. It makes you better. It makes you stronger. So it doesn't matter what the illness or injury is. Stress and negative emotions go to the places where the body is the weakest. So we must clear our lives of these things that don't enhance our health mentally, physically, emotionally, or spiritually. So what types of yoga are good for me? There's several different types of yoga that are great for people with injuries, illnesses, and disease. First of all, if you have limited mobility due to any of the injuries that I've mentioned or similar ones, one of the best yogas to practice would be restorative, gentle, or yin yoga. These are ones where you spend most of your time seated on the floor and you just do gentle movements where you kind of hold them for a little bit longer. And you're not going to break a sweat or anything, but you are going to get a wide range of movements at a slow and easy pace. They're very gentle poses with lots of modifications, so you can use pillows and blocks and straps or whatever you need. And great if you are in the first stages of recovery or new with an injury. Ashtanga Yoga, also known as Yoga Chikitsa. In Sanskrit, Yoga Chikitsa means yoga therapy. And this is a very rigorous style that should be taught on an individual basis for those with injuries. So when you're feeling a little bit stronger, when you're feeling that your body is ready to do more, go into Ashtanga Yoga. I know 2 people that had very bad injuries, very bad accidents. One was mountain climbing, fell, broke many, many bones in his body. And another lady was in a terrible car accident and also broke, I think she broke 11 bones in her body. After they healed, they found Ashtanga Yoga, and you should see them now. They're doing advanced postures. There is nothing that they can't do, but it took at least a decade before they went from point A, healing from their injuries, to thriving in their bodies. So it takes a really long time. And if you're looking for a quick fix to health and healing, you're not going to get it. Yeah, you're not going to get it. It takes at least a year. Okay. So remember that 1 year to get better. And then you can start working harder. Bikram yoga. I know, Bikram yoga. It's hot. Nobody wants to do hot yoga. Actually, the Bikram yoga sequence is also known as what we call the Ghosh lineage. Ashtanga yoga and Bikram yoga are set sequences of postures. They are both pretty rigorous. They are both ancient, scientifically proven sequences that come from India. So when you put the poses together, they are meant to be therapeutic and healing, and they are at least 100 years old, each sequence, if not more. So Bikram yoga would be good for people with shoulder injuries, only because they don't do a lot of vinyasas, no down dogs, no chaturangas, not only when your arms are above your head are you doing some of this, but really not a lot of pressure on the shoulder. So when my students come to me and they say, I have a torn meniscus or I have shoulder injuries or something like that, I recommend Bikram yoga. And I know it's hot, but the sequence is very therapeutic. You can also do the sequence online and not do it in a hot room. It's 26 poses and they repeat each pose 2 times. The next would be Kundalini yoga. It's more focused on breath, what we call pranayama in yoga, and meditation with some gentle poses kind of sprinkled in. So you're going to do a lot of energy releasing like this, maybe some arms up with breath work like this, hands on the body. Kundalini yoga is a great style of yoga. It's a little bit more rigorous than gentle, restorative, or yin, but still a gentler or restorative style of yoga. A lot of breath work, a lot of meditation mixed in. It's a great practice to help you connect with your body. And then we have Bhakti and Jnana Yoga. I put these at the bottom. We also have Kriya Yoga. These are 3 styles of yoga that don't involve asanas. These are yogas that are based in meditation, Sanskrit chanting, and philosophical study. So if you feel that your body is not ready to go back into the asanas or start the asanas, this is a good place to start. For example, one of my yoga students, God bless her, she was really rocking it in her asana practice, legs behind the head, thriving, going, feeling good. And she was up in her attic. She fell through the attic, landed in the garage, and broke her pelvis. Broke her pelvis. Can you imagine? So she was pretty much bedridden for weeks. And then when she started walking again, and she was only able to put weight on one leg. So what did she discover while she was immobile? Bhakti yoga, the yoga of devotion. And she focused her attention into the Sanskrit chanting and meditation, studying and reading the philosophical books like the Yoga Sutras, the Hatha Yoga Pradipika, and the Bhagavad Gita. So there are many ways you can practice yoga. I don't recommend not practicing asanas if you're not already fit. But if you need some time to let your body heal, follow the other parts of yoga, the bhakti, the jnana. Jnana is the yoga of knowledge. Bhakti is the yoga of devotion. And Kriya Yoga is a cleansing style of yoga, which cleanses the mind and helps to clear out the negativity. And all of these styles of yoga are really deeply rooted in the philosophies, the history of yoga. So there you have it. There it is. That is how yoga can help you heal. It can also help you thrive once you've been practicing for several years. So I hope that this masterclass was helpful for you. I hope that you expand your yoga journey. My name again is Maureen Dinkins. I am the owner and founder of clarityglobal.org. We do online yoga teacher trainings. We do supplemental courses. We also do in-person events. We are located in Orlando, Florida. And when you're ready to increase your yoga knowledge, look us up. We'd be grateful to have you in any one of our classes. Namaste.